is being held hostage by the executive. And we've seen this before. You saw it happen under the rule of Mr. Moi. And we have tried to caution the current Chief Justice not to go to bed with the executive. This is an unfortunate development.
Now listen to this, because it matters a lot when it comes to your health, whereby tuberculosis, that is TB, remains one of the top infectious causes of death globally. Well, Kenya has demonstrated worthy progress in achieving a 32% decline in TB occurrence and a 42% reduction in deaths between 2015 and 2020. TB remains a major challenge in the country. To deal with this, the National Tuberculosis, Leprosy and Lung Disease Unit under the Ministry of Health has launched the 2023-2024 to 2027-2028 National Strategic Plan for tuberculosis, leprosy and lung health, a strategic plan that sets out the roadmap for the realization of a TB-free world, more so here in Kenya.
The unique healthcare needs of children affected by this infectious disease. The adoption of the simplified diagnostic algorithm will ensure diagnosing TB in children is made easier, contributing to increased early and more accurate detection. This commendable initiative underscores Kenya's commitment to advancing healthcare and serves as a beacon of progress for the region in the collective endeavor to combat childhood tuberculosis. We continue to acknowledge the significant efforts put in by the government of Kenya in prioritizing the health agenda within the social pillar. The significant strides toward achieving universal health coverage, emphasizing a preventive and promotive approach, is pivotal for delivering holistic, people-centered TB care, particularly for people with TB who face socioeconomic vulnerabilities, as it will ensure access to quality, timely, affordable, and safe healthcare services. Hongera. As WHO, we stand ready to continue supporting the adoption of global guidance and initiatives, providing technical assistance, building capacity, and facilitating knowledge sharing to ensure that global best practices inform Kenya's efforts in combating tuberculosis. Thank you for your attention, and extend my best wishes to Kenya for great success in the implementation of these milestones.
Address TB in learning institutions, letting the Ministry of Transport handle TB that is within their jurisdiction, the Ministry of Agriculture to ensure there's sufficient food to combat malnutrition, Ministry of Interior to manage TB transmission within prisons, and the Ministry of Housing to ensure that we have policies that are in line with TB prevention, including proper lighting. The Ministry of Foreign Affairs to ensure that they safeguard TB-related human rights for migrating Kenyans. And the Ministry of Sports to leverage on sports platform for TB awareness. And the Ministry of Information to disseminate TB-related information to the public, similar to how they did it during COVID.
In Paris. I'm also very excited about the way this NSP was developed. Really just, looking at the data, engaging all the stakeholders, and using the most relevant science to make sure we have something that will get us to where we need to be. Finding at minimum 90% of the cases up from 68%, and reducing mortality further to make sure that we do not have deaths from a curable disease like TB. As I said, we've reduced by close to 60%, but we still had 22,000 deaths, actually many more than HIV did.
Now, moving on to other news, a 15-year-old girl failed to escape when a gold mine collapsed in a Naruoro village in West Pokot County. The victim, identified as Nakiru Ngoleyang, was with a group of women in the mine, but unfortunately, she did not manage to escape. On Sunday evening, a team from the county disaster team visited the scene to try and locate the body of the missing girl without success. West Pokot Special Programs, Humanitarian Coordination and Disaster Management Chief Officer David Chepolin said the department will camp at the scene until the body is retrieved. Chepolin, however, warned locals against engaging themselves in dangerous activities such as gold mining, boda boycotts, or rather gold mining. Sorry for that.
Hii watu alichimba gold siku ya Jumatano, akafunika mtoto. Kufunika mtoto, watu wakaripoti kwa polisi. Mtu ya nyumba hiyo akaripoti kwa polisi. Akakuja na polisi usiku. Kuripoti kwa polisi usiku, polisi akakuja mpaka hapa, akakuja kuona. Asubuhi watu wakakuja Alhamisi kutoa maji usiku mchana yote, usiku yote mpaka asubuhi. Mwili yako onekana mpaka saa hizi. Ndio saa hizi sasa tumekuja kuona hii sasa imeonekana kwa sababu ya harufu. Hakuonekana kwa sababu ya mwili, lionekana kwa harufu tu, na bado watu wanachimba, hajapatikana bado.
Ningeomba wenyeji wa hapa wajihadhari sana kwa kuchimba karibu na laga, kwa sababu anytime hii mvua ikinyesha maji inaanzia huko juu ikiteremka. So ningeomba sana kama iko njia nyingine wanaweza fanya, inaweza wasaidia kuliko hii, hata watoto wadogo wanaingia ndani.
Ni jukumu letu kama serikali ya kaunti kwa janga hili. Hasa kwanza kama mimi department yangu ya disaster management tukaamua response. Tumekuwa na ofisa wale wa disaster ambao tumekuja na hawa. So tukaamua kukimbia namna hiyo mpaka hapa.
And now to the story I was hinting about, matters boda, and at least 1,500 motorcycle riders in Kitengela town boycotted services on Monday morning, protesting random arrest of their colleagues by police over last Thursday's incident when riders were filmed stoning a motorist after a freak accident. The agitated riders said police officers have arrested riders indiscriminately for 3 days despite their leadership accepting to identify the culprits. On Monday morning, they boycotted a crisis meeting convened by police officers and local administration before they downed their tools. They carried placards condemning police harassment. All motorcycles were pulled out of the road, prompting transport crisis in the populous town. Riders who defied to unite with their colleagues were forcefully pulled out of the road. All motorcycles were parked at near Kitengela Assistant County Commissioner's office.
Kilifanyika pale Shell, ndio? Na wenzetu wengine wakahusika, tunasema pole kwa Wakenya wote. Semeni pole. Pole. Nataka muinue mkono, semeni pole. Pole. Tumeomba msamaha. Sawa. Number 2, sheria hairuhusu hata mtu akigongwa afanye nini, achukue sheria mkono. Hatuwezi lipa mabaya kwa mabaya. Kwa hiyo tunasema pole. Tunasema pole. Sawa. Hiyo ni point number 1. Number 2, mumeniambia niombe bwana OCS na security personnel, si ndio? Tukasema ya kwamba point number 2, sisi kama wana bodaboda, ofisi na bodaboda wote tuko tayari. Wale watu wote wako kwa hizo video tuwatafute usiku na mchana, tuwaweke kwa mikono ya polisi, wabebe msalaba ya. Sio ndio mmesema na mna hiyo?
Kibaya, hiyo ni kitendo mbaya sana. Na hata mimi bado sijapona. Kwa sababu niko na huzuni kubwa. Bado hii mkutano ilikuwa tu nikuje kuwaheshimu kwa sababu nimeona mumekusanyika hapa, nikuje tuongee, mjue ile mambo ambayo inaendelea. Mimi nilifanya operation, mimi OCS. I did operation na nikashika watu, nimewashika. Na bado nitawashika. Hao watu walienda kotini leo. Sio juu yangu kujua huyu ndiye amefanya makosa. Lakini wale pia wako na uwezo ya kuweza kujua nani alikuwa amefanya makosa na nani hakufanya makosa.
Tafadhali kwa OCS, we shall crack you down. Kuna mambo mengine hatuombi. In our training, we don't say please, we don't say urge. We just act. So Bwana OCS, with your team, I know you are so diligent, professional. Let us crack down all the illegal boda operators
who are not known by the boda members.
All right, tough talking security leaders there in Kajiado, Kitengela to be specific. Moving on, stakeholders from the financial sector are urging the government to ensure there is a fair balance between people's income and taxation by adjusting tax rates based on the economic conditions or financial problems facing people. This move is aimed at minimizing the impact on the average citizen facing financial challenges. Winners Sacco chairman Robert Kithanju also urges the government to reduce the cost of education in order to ensure better access.
Our assets imekuwa kwa kiwango kizuri to 11.2 billion kutoka 9 billion last year. Na last year tulikuwa tumepeana 3 billion, mwaka huu tumepeana 2 billion. Hiyo ni kumaanisha kwamba uwezo wa watu wa kumboro umeenda chini kwa sababu ya hali ya economy kwa wakati huu.
Tax has really affected our business, the implementation of affordable housing. Again, we are waiting for NHIF, which again is going to affect our business. And you know, once tax is implemented, it takes the net pay of the member. That reduces the borrowing power, of course affecting the members. So I would plead if the government can be able to review some of these policies of implementation of tax. They can also help us to do business. Implementation of tax to the SACCO. Of course, we have taxes that have come, like for those who are earning above a certain amount, being charged 35%. Again, there is also withdrawing tax, which is very high, 15%. Like the dividend we are declaring today, the member must leave 15%. That again affects our net pay of what our members are going to have. So
that, a non-state organization known as Tawisha Africa Initiative has embarked on an ambitious program that aims at reducing the rate of teenage pregnancies in Siaya County. The program, that is called GOtv Project, is based on sexual reproductive health as a concept that seeks to strengthen the protection of the rights of young people and more specifically the girls of the reproductive health. Speaking during the launch of the program, director and founder of Tawisha Africa Initiative, that is Dan Joshua Oduor, said that the project targets to work with girls and young women of the age between 11 and 29 years in Alego, Usonga sub-county. He stated that the move has been triggered by the high rate of teenage pregnancy, which still stands at 21% in Siaya. Oduor noted that they will work together with various stakeholders, including the church, national government administration, and the health department to ensure that the girls are saved from possible teenage pregnancies and matters of abuse or related to sexual reproductive health.
To celebrate and launch a project that is going to impact in our community. This project is called GOtv Project. It is based on sexual reproductive health as a concept, and we are looking to strengthen young people, especially girls, between the ages of 11 and 29. And these girls are going to be able to become ambassadors in the future within the area that we'll be working. We will work at Southeast Alego ward. And within this ward, what we'll be doing is working closely with the practitioners, such as the health sector, working with the religious institutions, and working with the national government. The question of the moment is why sexual reproductive health in this area? It's because nationally, and in Siaya as a county, the rate of teenage pregnancy has gone high. We are at 21% at Siaya County. That is way higher than the national average of teen pregnancy.
Community health promoters. As a stakeholder in this project, it is expected that I act as a linkage between the community and the facility. As the Director Tawisha had said earlier, Siaya County is one of the counties that is recording high teenage pregnancy. So in this project of GOtv, when it rolls out, we are expected that these teenage pregnancies are going to reduce because these teenage girls will be having knowledge. And two, there is also a plan with Tawisha that them that are willing to go back to school, they get back to school. And this is expected to help to impact in our society in that levels of poverty will be reduced. Two, the teenage pregnancy will also reduce in our society.
Elsewhere, Kandui Market residents in Bungoma County Monday morning woke up to the shock of witnessing patients at various levels of sickness and recovery being evicted from a local hospital. These as whereby the alleged reason for the eviction is a rent tussle between the owner of the hospital, one Sam Kuria, and the owner of the building over 7 million shilling debt. Patrick Wekesa, who had been admitted, or rather his nephew had been admitted at the Canon Hospital facility, was shocked by the incident and was forced to transfer his nephew elsewhere, leading to unplanned costs and a predicament suffered by other patients.
Canon jana tuleta mtoto wa my sister alikuwa mgonjwa na kufika hapa akalazwa. Sasa wakati alilazwa tukamwacha hapo hospitalini, hospitali ilikuwa tu sawa. So asubuhi saa 12 napigiwa simu kwamba watu wamevamia hospitali. Wakati nimefika hapa nimepata watu zaidi ya 200 wamevamia hospitali. Sasa akili yangu ikawa mtoto yuko wapi? Na nikaingia ndani nikapata mgonjwa yangu yuko ametolewa kwa drip. Wamefungiwa kwa room moja kama mabusu. Na watu ni wagonjwa. Sasa ile madawa ilibidi akatishiwe katikati. Ikabidi nitoe mtoto hapo. Nikakomboa tukutuku, nimemweka tena kwa tukutuku, nimempeleka GOtv. Na hapa naona wamevamia, wametupa vitu zote ziko nje. Maaskari walikuwa hapa na raia. Sasa sielewi shida ni nini. Ukuja kusikia baadaye nasikia ni mambo na rent. Hiyo hainihusu. Sasa vile tulifika GOtv, kadi haikufanya huko. Sasa imebidi tugaramike tena kwa mifuko. Kulipia tena huko upya na mtoto amelazwa tena.
Tumekuwa na shida na Landlord alikuja akamdanganya kijana wangu. Kijana nikamtuma aje atafute nyumba na akaja akapata nyumba. Lakini yeye alimfanya assign nyumba ati iko na kila kitu na akasaini kwa hiyo agreement. Lakini akasema baadaye atakuja kuitengeneza. Sasa ndio imekuwa shida. Mkiona hata hii nyumba ina ghorofa 3. Hapa kuna basement, hapa kuna ground floor, hapa kuna first floor na second floor. Sisi tumekuwa hapa tunatumia only the ground floor. Hii nyumba haijamalizika hii sababu hakutengeneza. Ya first floor hakutengeneza. Lakini anataka alipwe pesa yote, rent. Na amekuwa akisukuma sana. Mimi sikuwa karibu, kwanza nikaondoka kwanza